Feline Infectious Peritonitis, Pathophysiology, Clinical Manifestations, and Management. Feline Infectious Peritonitis, FIP, is a severe, often fatal disease caused by a mutated coronavirus that affects domestic cats worldwide. This article explores the disease mechanism, clinical presentations, diagnostic approaches, and emerging treatment options. Understanding feline infectious peritonitis. Feline infectious peritonitis represents one of the most challenging infectious diseases encountered in domestic cat populations, characterized by a high mortality rate and variable clinical presentations. The disease emerges when a common feline coronavirus undergoes genetic mutation within an infected cat's body, transforming from a typically benign intestinal pathogen into a highly virulent form. This transformation fundamentally changes how the virus interacts with the cat's immune system, leading to progressive and typically irreversible illness. Understanding the distinction between the precursor virus and the disease-causing variant is essential for comprehending disease prevention strategies and prognosis. The viral agent and transmission. The causative agent belongs to the alpha coronavirus genus, a classification it shares with other animal pathogens including canine and porcine variants. This positive-stranded RNA virus initially infects cats in its benign form, establishing itself primarily within the intestinal tract. The virus spreads among feline populations predominantly through contact with infected fecal material, making litter box sharing and poor sanitation significant risk factors. Most infected cats shed the virus in their feces while remaining asymptomatic or showing only mild gastrointestinal signs, making them unwitting carriers within multi-cat households. Key points: transmission occurs primarily through fecal-oral contact. Infected cats may shed virus intermittently or persistently. High-stress environments increase mutation risk. Crowded living conditions elevate transmission rates. Pathogenic mutation and immune response. The progression from latent infection to active disease involves spontaneous genetic mutations within the viral genome as it replicates in an infected cat. These mutations endow the virus with enhanced capability to evade immune surveillance and infect immune cells themselves. The resulting inflammatory response becomes paradoxically harmful. Rather than effectively eliminating the virus, the immune system creates a cascade of inflammation that damages the cat's own tissues. This immune-mediated damage distinguishes FIP from many other infections and explains why certain cats develop disease while most infected cats never progress beyond asymptomatic carrier status. The infection triggers either predominantly antibody-mediated immunity or cellular immune responses, with this distinction fundamentally influencing disease presentation. Cats mounting robust antibody responses without effective cellular immunity frequently develop severe clinical signs, while those developing strong cellular responses may remain asymptomatic. This immunological diversity accounts for the variable outcomes observed even among cats living in identical environments with identical viral exposure. Clinical forms and manifestations. Veterinary medicine recognizes two primary forms of the disease: the wet form, characterized by pathological fluid accumulation in body cavities, and the dry form, presenting with granulomatous inflammation affecting various organs. The wet presentation typically develops more acutely, with affected cats demonstrating abdominal distension, respiratory difficulty, and rapid clinical deterioration. The dry form progresses insidiously, often manifesting through nonspecific signs that prove challenging to distinguish from other chronic feline conditions. Key points: wet FIP, fluid buildup in abdomen or chest, respiratory distress, fever. Dry FIP, fever, lethargy, weight loss, organ involvement. Ocular involvement, anterior uveitis, secondary glaucoma. Neurological signs: ataxia, tremors, behavioral changes. Clinical signs and progression. Affected cats typically present with prolonged fever unresponsive to standard treatment, progressive weight loss despite adequate appetite, and general malaise. Abdominal tenderness, coarse hair coat, and icterus may develop as organ involvement progresses. The disease invariably leads to progressive clinical deterioration without effective intervention, though the timeline varies considerably between individuals. Some cats decline dramatically over days to weeks, while others maintain marginal quality of life for months with appropriate supportive care. Diagnostic approaches. Diagnosing FIP presents substantial challenges due to nonspecific clinical signs that overlap considerably with other feline diseases. Laboratory evaluation reveals characteristic changes including elevated globulins, elevated fibrinogen, anemia, and lymphopenia in many cases. Peritoneal fluid analysis, when the wet form is present, demonstrates a clear to straw-colored exudate with high protein content and typically includes neutrophils and macrophages. Definitive diagnosis traditionally required viral confirmation through various molecular and serological techniques. Key points: serology testing for coronavirus antibodies, sensitive but not specific. RT-PCR in blood or body fluids, variable sensitivity depending on specimen type. Immunohistochemistry and PCR on affected tissues, most accurate. Abdominal ultrasound, identifies effusion and organ involvement. Prognostic indicators. Several factors influence survival and quality of life in diagnosed cats. The presence of neurological signs typically portends a graver prognosis, as does severe systemic inflammation as evidenced by extremely elevated inflammatory markers. Cats presenting with advanced liver or kidney involvement demonstrate reduced survival times. Conversely, cats identified earlier in disease progression and those responding to specific antiviral interventions show substantially improved outcomes compared to historical data. Emerging treatment options. Therapeutic approaches have evolved significantly in recent years, moving beyond purely supportive care towards specific antiviral and immunomodulatory interventions. Certain nucleoside analogues and protease inhibitors demonstrate in vitro activity against the virus, with promising results in clinical case series. Immunomodulatory agents and interferon preparations aim to enhance the cat's cellular immune response, potentially shifting the immune balance toward better viral control. These emerging treatments have fundamentally altered the clinical landscape, transforming FIP from a universally fatal diagnosis to a potentially manageable chronic condition in some cases. Key points: nucleoside analogues inhibit viral replication machinery. Protease inhibitors block viral protein processing. Interferon alpha enhances antiviral immunity. Supportive care, fluid therapy, nutritional support, pain management. Prevention and risk reduction. Preventing FIP development focuses on reducing initial coronavirus exposure and minimizing factors promoting viral mutation. Maintaining clean litter facilities with separation of litter boxes in multi-cat environments substantially decreases transmission. Stress reduction through environmental enrichment and proper socialization influences disease development, as psychological stress appears to increase mutation likelihood. Vaccination efforts have yielded limited success to date, though ongoing research continues toward more effective immunization strategies. Testing protocols help identify persistently infected cats that warrant isolation in multi-cat settings. Current research and future directions. Contemporary research efforts focus on developing superior diagnostic methodologies capable of distinguishing active infection from past exposure more reliably. Genetic sequencing of viral isolates from affected cats provides insights into the specific mutations facilitating pathogenesis. Pharmacological research continues expanding the arsenal of antiviral agents with improved efficacy and tolerability profiles. Understanding host genetic factors that predispose certain cats to mutation and disease development may eventually enable identification of at-risk individuals before clinical signs emerge. Additionally, investigation into the immunological mechanisms governing recovery versus progression promises to unlock strategies for enhancing favorable immune responses. Management considerations for veterinarians. Veterinary professionals encountering suspected FIP cases must balance pursuit of definitive diagnosis against the clinical urgency of the presentation. Early consultation with infectious disease specialists or experienced practitioners familiar with emerging therapies optimizes patient outcomes. Transparent communication with cat owners regarding realistic prognosis, treatment costs, and quality of life implications facilitates informed decision-making. Documentation of treatment protocols and outcome tracking contributes valuable data to the growing body of clinical experience with newer therapeutic approaches. Multimodal supportive care remains essential even when specific antiviral agents are employed, addressing nutritional needs, pain management, and secondary complications. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.